All right, today we're putting on our detective hats to solve a really fascinating medical mystery. We've got a patient with a super confusing set of symptoms, and together, we're going to follow the clues and crack the case of what's really happening inside their brain.
You know how every good mystery starts with some kind of puzzling event, right? Well, in our case, it all begins with a patient whose symptoms are, let's just say, both specific and really perplexing. So let's get right to the central question. So here it is, the core of our mystery. We have a 39-year-old woman, and she shows up with this specific triad of signs. She's confused, she's seeing things that aren't actually there, and she's making this repetitive motion with her mouth. Each one of these is a clue, and trust me, together, they point to something very, very specific. Okay, so to solve this, we can't just guess. We've got to work like real investigators, examining each piece of evidence one by one to figure out what it's telling us about the bigger picture. So let's start with our very first clue.
First up, clue number 1, she's confused. This immediately tells us that something is messing with her awareness, her level of consciousness. She's not fully present, not really able to process what's happening around her. This is an absolutely critical piece of the puzzle. Then we have clue number 2, hallucinations. Now, this isn't just some random thing. It points directly to a disturbance in her sensory perception that's coming from inside the brain itself. Her own brain is creating experiences that aren't real, which really helps us narrow down our search.
And for our final clue, we've got the repetitive lip smacking. There's a technical term for these, automatisms. They're basically repetitive, purposeless actions that a person does without even being aware of them. And it's not just lip smacking. It could be chewing, swallowing, or even just picking at their clothes.
All right, let's pull it all together and create our case file. We've got impaired awareness, that's the confusion. We've got hallucinations, and we've got automatisms. This combination isn't just a random jumble of symptoms, it's a classic signature, a calling card that points directly to a specific kind of neurological event.
So now that we've got our evidence all laid out, we need a list of suspects. In the world of seizures, the investigation always starts by dividing them into two major categories. Let's take a look at the lineup. When it comes to seizures, you can basically split them into two big groups. On one side, you have partial seizures, which start in and only affect a limited part of the brain. And on the other side, you've got generalized seizures, which involve the entire brain, right from the get-go. This distinction, it's the key to our whole investigation.
Okay, this is where the fun begins. We've got our evidence file, and we've got our list of suspects. Now we can start the process of elimination. We're going to take each potential diagnosis and see if it actually matches the clues from our patient.
Our first suspect on the list is a simple partial seizure. Now, the most important phrase here is without affecting consciousness. The person stays completely aware during the whole thing, even if they're having some pretty unusual sensations or movements. And just like that, we can rule it out immediately. Our case file clearly states our patient has impaired awareness. She's confused. And since a simple partial seizure doesn't affect consciousness, this is not our diagnosis. One suspect down.
All right, next up, a focal motor seizure. Now, this one is actually a subtype of the suspect we just eliminated. Its main calling card is localized muscle activity, like a twitching arm or a jerking leg.
And again, this just doesn't fit the evidence we have. Our patient's key symptoms are that altered consciousness and the lip-smacking automatisms, not some localized muscle jerking. So we can confidently cross this one off the list too. So our last incorrect suspect is a generalized seizure. Remember, this is the type that hits the entire brain all at once. It usually looks pretty dramatic. We're talking the full-body convulsions of a tonic-clonic seizure or that staring off into space look of an absent seizure.
But even though they're dramatic, a generalized seizure just doesn't produce that specific signature we see in our patient. That unique trio of confusion, hallucinations, and automatisms, it's just not its MO. And with that, we've eliminated all but one possibility. We're getting so close to solving this thing. After all that careful detective work, after examining the evidence and ruling out every diagnosis that didn't fit, we have finally cornered our culprit. It's time to reveal the diagnosis that perfectly matches our case file.
And the solution to our mystery is a complex partial seizure. I mean, just look at how perfectly the definition lines up with our clues. A change in consciousness? Check. Our patient is confused. Hallucinations? Check. And automatisms like lip smacking? A definite check. It's a perfect fit, and it makes so much sense because these seizures often come from the temporal lobe, the part of the brain that handles memories, emotions, and perception. Case closed. So, knowing the diagnosis is great, but let's be honest, remembering it is even better. How do we lock this information in so it doesn't just go in one ear and out the other? Well, let's look at a simple but really powerful tool to make sure this sticks with you.
Here's the trick. It's a super simple way to remember it. Just think of the word complex in two different ways. Complex behavior refers to those automatisms, the lip smacking, the chewing, the picking at clothes. And complex consciousness refers to that altered awareness, the confusion and the hallucinations.
So, if you ever see someone who just doesn't seem fully there, who is doing some kind of repetitive, purposeless action, and maybe they seem confused or mention a strange experience like déjà vu, your brain should immediately think complex partial seizure. It's a really clear, actionable checklist. And that really brings us to our final thought. We've gone all the way from a puzzling case to a clear diagnosis, and best of all, a way to actually remember it. So I'll leave you with this question to think about. Now that you can spot these specific signs, how might this knowledge actually change the way you respond or even help someone in a real-world situation?